Hi, I'm Michael and welcome to California. To start off, we at California just want to say that our thoughts go out to all of you who may be affected by the coronavirus. We hope that you and your family are safe, healthy, and prepared for the next couple of months. That being said, like everybody else, we're on lockdown. We're getting ready to be stuck at home for the foreseeable future. But luckily, we're all stocked up with the essentials like toilet paper and canned food and the holy grail for the moment, cleaning wipes. But today, we're going to discuss something a lot of folks don't think about much in these uncertain times, and that is health insurance coverage. Now, I know it's not sexy, but for those who currently have health issues or potentially may have health issues in the near future, health insurance coverage is a major concern. So today, we're going to go over some of the new changes to enrollment rules and health plan benefits that are being implemented right here in California to help fight the coronavirus and assist people who need to get health coverage. So put on your face mask, slather on some hand sanitizer, and let's get into it. Now, especially with the continuing spread of the coronavirus, it is important to understand what are your health options and how you can get access to them. And for the most part, the plans that we'll be covering in this video are for people who don't get insurance offered to them through their work. So we're talking about private health insurance plans like Blue Shield and Health Net and Sharp and Kaiser and others that can be enrolled either through Covered California, which are eligible for subsidy, or enrolled directly with the carrier, which are not eligible for subsidy. But they are plans that both individuals and families can enroll into. So first, let's talk about plans through Covered California. Now, Covered California plans are private health insurance plans that can be purchased through the California Health Exchange or Covered California. These plans are not Medi-Cal, nor are they Medicaid plans, but they are eligible for a portion of the monthly premium to be paid by Covered California. The cost of these plans changes based on a person's household size, age, income, and zip code. And in general, the more you make, the more you'll pay. And the less you make, the less you pay. But for a family of four with an income up to around $160,000 a year, it is still possible to get some help paying for that monthly plan. Now, usually people can only enroll in these plans during the open enrollment period, which is November through January. Outside of this time frame, it is still possible to get enrolled, but you have to have what is called a special enrollment period as a result of a life change. Examples of these would be I got married, or I had a baby, or I moved, or I lost my health insurance through my work, and changes like that. And when someone has one of these life changes, it means they are eligible to enroll into a plan anytime within 60 days after that event occurs. But it's super important to note that need, like I got sick, or I broke my arm, or I got pregnant, are not considered reasons why somebody could get enrolled into Covered California or any other health insurance plan outside of the normal open enrollment period. So for folks who need to enroll but don't have one of these life changes, they usually have to wait until the following year's open enrollment period to enroll in November. But in response to the possibility of so many people in California needing health insurance coverage because of the coronavirus, Covered California will now allow anyone who needs to get enrolled into a health plan to enroll with no life change required. This special enrollment will last from now until the end of June 2020. This means that anyone who needs to get health insurance coverage will be able to do so without needing a special reason. Now, one very important thing to consider is that insurance plans will cover your health care expenses, whatever they happen to be, but they will not cover medical bills you got prior to the start of your plan. So for example, if you got sick or you got hurt today, but your insurance plan starts at the first of next month, those bills you got today will not be covered by the plan when your plan starts the next month. So even though you may be in perfect health right now, if that changes and your plan starts after your health event happens, you will still be stuck paying those bills. So in my view, it's much better to be safe and get coverage right now than get coverage after you actually need it and then have to pay some sort of giant bill and be sorry. And besides, is there even really any excuse not to get coverage? Like literally, there's a health pandemic going on right now. So my recommendation is go to coveredca.com or contact a Covered California certified enroller, like us, to help you get enrolled. Like right now. No, really, go. I'll wait. Okay, so the first big change is that Covered California will allow anyone to enroll, no questions asked, until the end of June 2020. But what about if you get your coverage directly from a carrier, let's say like Oscar or Sharp or Blue Shield or any number of other plans? So far, none of the carriers have announced that they will have a special enrollment period like Covered California. But Coverage California's decision was just announced, so I'd expect to get some sort of response from the carriers in the near future if they will follow Coverage California's lead or not. That being said, it is still possible to enroll with the health insurance plan as long as you have one of those traditional special enrollment periods or life changes. This means you had a life change like you gave birth, or you moved to California, or you lost your previous health insurance, or you no longer qualify for your health insurance through work. If these situations happen, then you can still get enrolled into a plan directly with an insurance carrier, but you only have 60 days to apply. If you are outside these 60 days after your life change happens, and you still want to apply directly with the insurance carrier, as of right now, you'll have to wait until next year's open enrollment period in November. Okay, finally, let's talk about some changes that are being made by insurance plans that will help people who are already enrolled fight the coronavirus. Luckily, there has been a big and quick response by most insurance companies to make it easier to get diagnosed, tested, and treated for the coronavirus. Almost universally, health plans are starting to waive the costs associated with testing and diagnostics related to COVID-19. This means they're lifting the cost for co-pays and deductibles and co-insurance and most costs associated with the testing. Just off the top of my head, we got notifications from Blue Shield, Molina, HealthNet, and Oscar that these costs are being waived. Now, this doesn't mean that treatment will be at no cost. If you're getting treated for COVID-19, there are still going to be some costs for the treatment, but the costs for testing and diagnostics have been waived. Another way many insurance plans are working to adapt the current health insurance climate is they're lifting restrictions on refill caps for prescriptions so that you can have some extra medication stored away just in case over the next couple months it's not possible to get out of the house and to the pharmacy, as well as relaxing some restrictions on home delivery or even waiving the cost for delivery of specific medications. Additionally, to go even farther, some health plans are encouraging their plan members to utilize the Teladoc benefits that come automatically with their plans in order to avoid having to go into the doctor's office if it's not absolutely necessary. Of course, you still want to check with your insurance carrier directly to see if they're making these changes to your plan, but it's amazing to see how earnestly and rapidly insurance providers are making changes to try to help fight the spread of the coronavirus. So let's do a quick recap from the points of today. First, Coverage California is creating a new special enrollment period for people to apply without any life changes up until the end of June 2020 as a response to the coronavirus. And second, health insurance companies are waiving the cost for testing and diagnostics associated with the coronavirus. So if you still have not enrolled and you need help reviewing your options, please reach out to us here at California. We'll be happy to make new videos or post a response to your question. So please don't forget to like and subscribe to get updates when our newest informative videos are available. And for California, I'm Michael, wishing you a happy, healthy